Hello folks. Now let us discuss something about the types of the bladder dysfunction. Bladder dysfunction, that means the types of urinary bladder dysfunction. Let's straight away jump into the topic. Right. So there are different kinds of the dysfunctions of the bladder. To start with, we can start with the type of the bladder. For example, the type of the dysfunction, we can go into the pathophysiology of the dysfunction. We can see what the symptoms are, and also we can see what are the probable causes for that. Now, in the previous video, we have discussed about the innervation of the urinary bladder and the urethra. If you have not watched that video, please go to my channel and watch that video, and after going through that, we can understand this topic better. So straight away starting with the type of the bladder dysfunction. To start with, the number one type of bladder dysfunction is the stress incontinence in the bladder. By far it is the most common type of the incontinence, which is generally faced mostly in the women. Around 25 to 45% of the women have the bladder incontinence. Around 25 to 45% of the women have the bladder dysfunction. 25 to 45% of women, right? What happens in the stress incontinence? There is the weakness of the sphincter. The sphincter becomes weak, and or there can be the pelvic floor weaknesses, right? Now, what are the symptoms in this stress incontinence? The urine flow, it increases, or the urine flow occurs due to increased intra-abdominal pressure. Increased in intra-abdominal pressure, maybe the cough, the sneezing, lifting up heavy weights. These kind of the maneuvers causes contraction in the urinary bladder, and as a result, due to the sphincter weakness and the pelvic floor weakness, there is the incontinence or the urine flow out. So what causes it generally? What causes it? It is most commonly seen in the women, and the childbirth or the more number of parity is considered to be the great culprit for that. And second factor is obesity, and in men generally it is seen after prostatectomy. After prostatectomy it is seen, right? So now coming to the second type of the incontinence or the bladder dysfunction is called as the urge incontinence. Urge incontinence. What happens in the urge incontinence? In the urge incontinence, there is detrusor muscle overactivity. Detrusor muscle overactivity, and this overactivity is generally due to the irritation in the bladder, or the loss of inhibitory controls, over the bladder, right? The loss of inhibitory controls over the bladder is the likely cause for the urge incontinence. Now, what are the symptoms in this? Now, for the symptoms, there is loss of urine, or the patient loses a lost urine on way to the toilet. Patient feels a lot of urge to pass the urine, and while going to the toilet, he or she passes the urine. Or the contraction is sometimes stimulated by the various kinds of the stimuli. So contraction is stimulated by various kinds of the stimuli. For example, whenever there is a sound of the running water, the hand washing, etc., can stimulate the bladder to contract. Or it can also occur due to the change in body position. For example, a patient is going from supine to erect posture. At that moment, the patient can feel an urge or irritation in the bladder, and the bladder gets emptied itself. That is known as the urge incontinence. So generally, what causes it? Most common reason is cystitis or the inflammation of the bladder. Also, the prostatitis can cause it, right? There are certain strokes in the patient can cause, or the spinal cord injury in certain patients can lead to that. Parkinson's disease is also a common factor for that, Parkinson's disease. So these kinds of bladder we can see. What are the other kind of the bladder? Now, third, there is a mixed variety, the mixed variety of the incontinence, in which there is both the urge incontinence and the stress incontinence kind of the features, and it is due to the both kinds of activities are being seen. I am writing the similar. The symptoms are also more likely the above symptoms combining the both, and the causes are generally combining the both, and both can be the causative factors for that, and we can see the overlap kind of picture, right? What are the other kind of the bladders? Other kinds are normally like the overflow incontinence, and it is generally not seen in the much higher incidence. Only the around the 5% of the bladder dysfunctions account for the overflow incontinence. And why does it occur? Right? It occurs due to the urinary retention, right? What in the urinary retention, what happens there? There is over-distended bladder due to, and what are the causes for the over-distended bladder? The cause for that is impaired detrusor contractility, right? Or the other cause can be bladder outlet obstruction, right? So these are the causes for the, or we can say the pathophysiology for the overflow urinary incontinence. Now coming to the symptoms part, how does it present? It presents as a dribbling of the urine, urgency of the urine, or a feeling of fullness after going to the washroom, right? And where it is seen generally? It is seen generally in the patients with BPH, benign prostatic hypertrophy. Also in the patients who are taking some kind of anticholinergic medications. In the uterine prolapse, in the patients suffering with the diabetes, multiple sclerosis, spinal cord injuries. These are some common factors in which the overflow incontinence is being seen, right? Lastly, we can discuss about the last bladder dysfunction, that is the functional modality, the functional part. Here there is a variable leakage. It is not particularly associated with any urge, any stress, or any overflow, but it is a variable. And there are certain associated features which are non-urinary causes. And there are some cognitive dysfunctions. Generally, it is seen in the patients who are demented, or the dementia, or the patients suffering from some neuropsychological illnesses like depression. So I think I have covered most of the topics of the type of the bladder dysfunction. This is the overall summary. And if you like to have some notes, please do comment to me to make such more videos. And please subscribe to my channel, hit the like button, and please do comment what next should I upload. Thank you for the patient hearing.